Further, there is a goiter, that means is the thyrotoxicosis or enlargement of the goiter gland, enlargement of the thyroid gland. In that condition, we wanted to treat, because that is the endocrinologist or especially the thyroid specialist need to handle this. But however, as a supplementary, people wanted to come, you understand, T3, T4, TSH, three parameters are normal. But when they do the thyroid scan, so thyroid scan shows there is an enlargement of the thyroid gland. So that situation need to be done. So ask them to activate the same point is advisable, to apply the pressure on LU3 every day. That always is good. Then again you wanted to do as a local points you wanted to treat, but local points are not advisable much to needle, because there is a, I'll tell you later period, but there is a, the major arteries are existing on that region. That's the reason carotid artery we shouldn't damage. So that causing the problem. For that alternative is there, that's called as a PNST, the prickling neurostimulation technique. But around the thyroid gland, we activate by using the toothpick therapy. So then you just invert the toothpick and then give the pressure vicinity of that region. Again, both the thyroid and parathyroid gland, you just activate, regulate this region, then it improves the microcirculation over that region, and also slowly the goiter, whatever there is, the goiter is nothing but insubstantial phlegm is accumulated. So there is a substantial phlegm where you spit that phlegm, that where you can see that phlegm, that to be known as a visible phlegm. The insubstantial phlegm, that you cannot see that phlegm, whatever the adipose tissues, whatever there is a accumulation of the hematoma or something related to the lipomas or the fibroid or the cyst or the tumor, all are connected to the goiter, is connected to the insubstantial phlegm which is accumulated as per the traditional medicine. So therefore you need to dispel that phlegm. You just use this point, but this majorly good. Along with that, to dispel, use the local points, and further you wanted to treat by activating some of the points, the 100 meeting points of the phlegm, that to be known as a Ka Huang Shu, that is UB43. The major one more point to be known as the Feng Lung, that to be known as a stomach 40. Stomach 40, and then this LU3 point, all together you just activate, that chances are there definitely the phlegm accumulation or the goiter slowly will melt and slowly will get dissolved. But however, take the opinion of the endocrinologist, ask them to consult the endocrinologist, and then come forward for the treatment. Even they need not to take much medication. Slowly this will going to disappear. Later we do that one more scanning, then further proceed for that, if they do have the time period. Because there is a voice box that's called as a, sometimes is the larynx and pharynx and trachea, that shouldn't voice box. And further there is the, what is the pharynx? Pharynx is the tonsils. What is the larynx? Larynx is the voice box. The enlargement of the thyroid gland shouldn't become the complication. Then slowly what I am talking, my voice is slowly coming down. What was previously I am screaming, that cannot be possible now. I cannot scold to anyone, I cannot abuse to anyone. So now the voice is very less, then indicating that is affecting to my voice box as well. So that's the reason technically need to be considered with the technical person, and then further you take the treatment with us with the holistic way, definitely having the positive results in order to get the maximum relief. Hopefully you understand. Still the thyroid gland, thyroid related problem is there. Then you understand the hypothyroidism, where the TSS level get excessiveness. That time we need to remember one point. That point is known as there is a point to be known as a fire constitution is very poor to them. Fire level is less within them. The fire energy is low. That need to be increases the fire chi. So that need to be activated by using the endocrine meridian. That meridian to be known as a triple warmer meridian, Sanjo meridian. In that meridian, you just activate the MN and then Chung Chu. The points called as a Sanjo 2 and then Sanjo 3 and then Sanjo 3.5. So Sanjo 3 is this. Sanjo 3.5 at the base of the fourth and fifth metacarpal bone in the depression. You just apply this point as well. Where as per the Sujok, this is a suprarenal gland, adrenal gland. So there you just apply the needle to treat for the pituitary gland as per the modern medicine. So you treat to the pituitary gland, you treat for the adrenal gland, you treat for the thyroid gland as well. You just activate these are the 3 points are always is good to treat for the thyrotoxicosis or the hypothyroidism related problem. Hyperthyroid or the hypothyroid. Both the conditions we just activate some of the points.
Triple warmer 3.5. One more time, look. Tell me the location, sir.
Yeah, now you just folded this and then this is Yemen. Yemen is Sanjo 2 midway between the two web margins. Then you just head of the metacarpal bones in the depression. You just apply Sanjo 3. Use Sanjo 3, you go upward direction. You can find the depression. You can find the end. That is the base of the fourth and fifth metacarpal bone in the depression. From here metacarpal bones. From here metacarpal bones. From here it completed the metacarpal bones here. That means it's the starting point of the metacarpal bones. This is the first metacarpal, this is the second, this is the third, this is the fourth, and this is the fifth metacarpal. But here is the point to be known as a Chung Su, that is Sanjo 3.5. That's also pituitary point. That also to be known as a pituitary point. So you just activate. Then again we wanted to understand in the extraordinary level. We wanted to treat for the hyperthyroidism or the hypothyroidism. You can consider the one more element or organ to be known as a pericardium. Pericardium. The pericardium is the Laugung. Laugung is the P8 point. P8 point. Then again you wanted to treat for the especially P8 tonification is always is good. Then again I remember that one more point you just apply, that's called as a Qian Shi. That means is the pericardium 5. Pericardium 5 also related to the adrenal gland point. That point also important. But use that point and also use the pericardium 8 point tonification to treat for the hormone related disorders, especially thyroid related conditions. Maximum benefit can be taken place, and people who consume the medicines slowly they can taper the medicine. Maybe they are taking the 150 mcg, then come to the 100, then come to the 75, 50, and then 25 mcg. But they wanted to withdraw, take the opinion of the endocrinologist and then ask them to stop the medicine. That always is good. By the way, wanted to activate the Sujok ring. So you just activate the Sujok ring. This is the thyroid. So once you activate this thyroid area, this is as a thyroid, this is the parathyroid. Both the glands are existing here, where exactly the below the first interphalangeal joint, right? Where exactly the thumb starts. So there the creases are there. This is the entire crease to be known as a thyroid and then parathyroid gland are existing as per the microsystem of acupuncture. You activate by using the Sujok ring, apply some oil over this region and then activate this point is really good to treat for the thyroid related disorders. See, this is the web margin. This is the web margin. Just slightly above the web margin, the point is located. Now you just apply. Don't apply towards the pinky finger. You should apply towards the ring finger. Then you look at about the depression. You just try to find out and find the depression. Don't apply the needle to the bone. You just apply the downwards direction. In this way we just apply. This is the triple warmer 2, always sedation. This is the grandmother point, which is the point, this is known as a grandmother point. But at the same time what happened, this connectivity to the Kunlun UB60, this connecting, this is the water point. So water get excessiveness causing the problem in the thyroid. So we need to minimize the water level. So due to that reason, the Sanjo water level I reduce, then the fire level I am increasing. That's the reason I just applied in this direction. Always I apply in this way. Sometimes I apply tonify as per the clinical case study. Now I just apply Sanjo 2 and then Sanjo 3 and then 3.5 I just apply. Now I just apply this towards the tonification and then I apply this as a perpendicular for the pituitary. See, this is the one is mother point I activated, that is towards the tonification of the energy flow. The third point I applied the perpendicular. This is the numerous functions. I'll tell you the same point to treat for some other diseases also, right? Because pituitary point is the mother point, gland, which will be useful for the many conditions. But however, this is for the thyroid related disorders, can be treatable successfully by using these points.